Hi, welcome everybody to my YouTube channel. I am Dr. Pradeep Kumar Shenoy, consultant rheumatologist at Amrita Multi-Specialty Clinic. This is the first rheumatology clinic of Dakshina Kannada and Udupi district. In this video, we will see how a chemical is converted into a medicine, and also we will see what is the philosophy of adhering to anti-rheumatic drugs on a long-term basis. Drugs undergo different phases of clinical trials, starting from phase 0 to phase 4. In phase 0, we will see whether the drug is entering the target tissue of interest. This is usually done in cancer study. In phase 1, the drug is given to healthy volunteers in different doses, and the maximum dose tolerated by the healthy volunteer is noted. In phase 2, different doses of drugs are given to the patients, including the maximum dose tolerated by the volunteer in the phase 1 trial. In phase 3, there are three arms. In the arm 1, patients are given the drug under the study. In arm 2, patients are given the gold standard drug. In arm 3, the patients are given a placebo. Placebo is a physical form in which there is no drug is present. So, if the drug under study is superior to placebo and the gold standard drug, only then the drug is marketed. So, when the drug comes into the market, it is absolutely safe. After this, when the patient comes to a rheumatologist clinic, after the detailed history taking and physical examination, doctor comes to the correct diagnosis and looking into the reports of the results which he has requested after physical examination and history taking, he comes to the correct drug and prescribe the correct dosage of the drugs after considering patient's parameters like height, weight, body mass index, associated comorbidities, etc. Now, onus on the patient to accept the illness and accept the drug. So, the patient has to have faith on oneself, medication, and allopathy along with higher power. All these faiths put together, there is a strange chemistry which works. I'll explain to you how it works. In an Australian study which I have read long back, those patients who had faith in higher power had a higher rate of recovery and faster recovery, which means that all the faiths are important. There are two principles which one should remember. That is one day at a time and keep it simple. One day at a time means patient has to take one day medications without thinking about further consequences. So days culminates into weeks, weeks culminates into months, and months into years, and then years into decades. So if you keep one day at a time, and if you make a day good day, the entire year, subsequently entire life becomes good. And if you keep a problem, how much ever complicated it is, simple, a solution will emerge from within the problem, because the reflex behavior, intelligence, prudence, everything remains intact if you keep it simple. So these are the two principles a patient with rheumatic illness should adopt. In conclusion, the need of the hour is allopathy. If you stick to allopathy, you will be rewarded. I request you to not to be carried away by any other modality. In allopathy, we have protocols for everything. If you allow us to apply the protocol, even the event of any complications, there is a solution given within the protocol. So, the allopathic medications are absolutely safe. We are aware of what we are doing. So, please adopt allopathic medications for all rheumatic illnesses. Thank you.